Ralph, after something like this, does the patient still have to undergo, let's say, something like physical therapy or an exercise program? Is that suggested?
Sometimes, yeah, that is the case.
Okay, and do you suggest that, Dr.
Yes,
Mena?
we do. After the procedure, normally one of the things that patients, they will ask us will be how soon I can start my activities. The activities can be started like right away. So normally, right away meaning next day after the procedure, because this is not a surgical procedure for the most part.
Yeah.
So we're putting a medication. The medication is going to be reabsorbed by the area in the body. So it's nothing that we put instrumentation in there. So the patient can resume all activities. Normally, the day of the procedure, we tell them to kind of take it easy because we just did a procedure, but for the most part they're clear to do the activities as tolerated.
And you said something, and I'm going to use your words, when the procedure is done correctly, which is very important. Does the shot work?
The shot works for the most part for most of the patients. Unfortunately, there are some patients that they don't get the improvement that they're looking for. They might get the improvement from the local anesthesia, but they might not get the long-term improvement. And those are the patients that, unfortunately, they become more of a surgical candidates.
And when it comes to risks or complications, because patients are always worried about that, are there any, doctor?
There are. These procedures are normally, as I tell the patients and people, normally this procedure are minimally invasive or maximally dangerous. So if for some reason the patient is taking some blood thinners and we do the procedure without knowing that they're on a blood thinner, or the physician does the procedure without knowing that they're on a blood thinner, actually catastrophic complications can occur because they can be bleeding into the area where the nerve are, and that can cause a bleeding and they will require an emergent surgery. Yeah. So for the most part, the risks are really benign. So most of the time might be flushing, rash, itching, which are things that people might be allergic or not allergic, they might be a little more sensitive to the steroid itself. Yeah. So those things can happen, and they're, for the most part, self-limited. One of the things that can happen is that the patient is not aware that they are allergic to the contrast medium, to iodine. That can become a little more challenging on some patients, and they can develop some even difficulty breathing.